Okay. Now the palpation of lateral elbow. Again, it will start same as the medial palpation of elbow joint. So first of all, you have to place your hand over the shaft of the humerus, identify the bony consistency, and follow it in inferior direction, and ultimately you have to perform this transverse grip and confirm the location of the lower end of the shaft of the humerus. As well as you will reach in downward direction or towards the elbow joint. This bony consistency again change in a border-like structure, edge-like structure. Basically, that is the location of your supracondylar ridge again. From here, you can feel the mixed type of consistency. It is not clear-cut bony edge. It is little bit mixed. Why? Because the brachioradialis take origin from the superior part of the supracondylar ridge of the lateral elbow or lateral side of the lower end of the humerus. So basically this is the location from where the brachioradialis originates. For the confirmation, if you want to identify this muscle, again instruct the patient to keep the elbow in mid-tone position and then try to flex the elbow. Yes, and you can feel the muscle contraction. See, it is already marked over here. Relax. Yes, flex. Now, this belly is getting prominent. So this is the location of your brachioradialis. It is completely marked. Next, again, when you further move your thumb pad inferiorly, you will find another attachment point of the muscle, which is it is just found just inferior to the brachioradialis. This is the location of your extensor carpi radialis longus. Again, ask the patient to perform the wrist extension, pure wrist extension with little bit radial deviation. So this muscle is getting prominent. So I can feel the contraction of the muscle. So this is the location of your extensor carpi radialis longus. Next, when you move your thumb pad, just follow the bony edge. Ultimately, you will find the multiple muscles attachment or mixed type of consistency, which is found because of the attachment of the muscular attachment. So this area basically, ultimately you will reach over the lateral epicondyle. So this area provides the attachment of the rest of the common extensor group of muscle. So in case of tennis elbow, if you identify, see this is a bony projection, it is a clear cut. For the confirmation, you can perform the circular palpate technique. This is the most prominent area of the lateral elbow and it provides the attachment of all the extensor group of muscle. And in case of tennis elbow, this area will be tender. When you apply pressure, patient will complain of pain or tenderness. Again, this is a bony landmark and it is used for identification of further other landmark which is found surrounding to this structure. So after identification of lateral epicondyle, we can also identify the radial head. How? Just mark the location of lateral epicondyle and further move towards the inferior direction. You will find a gap. Basically, this gap is found between your radius and capitulum. So this is I can feel the bony consistency. Basically, my thumb is right now over the capitulum, and if I slide it further, so I can feel a gap, and after that gap there is again a bony consistency and a prominence or bony protrusion is coming out. So this is the location of your radial head. How to confirm? Just again for the confirmation, perform supination and pronation of forearm, and you will feel that the structure underneath of your thumb pad, it is moved. So this is the location of your radial head. If you slide your thumb pad little bit more inferiorly, so you will find mixed type of soft tissue consistency, and this is the location of your annular ligament. In case of pulled elbow, basically this the radial head slip from this ligament, and that condition is called pulled elbow. Okay. So basically these are the landmarks which we can identify for the lateral side of elbow. Here I would like to discuss the few landmarks basically which is found in the posterior side of the elbow. So again, for identification of rest of the landmark, first of all we have to identify the bony landmark which is used for localization, that is your olecranon. So this is the location of your olecranon, and this is again the point where we can identify the bursa, olecranon bursa. This is the same location, it is just found just posterior to your olecranon, and in normal subject we cannot identify the bursa, but if your bursa is inflamed, so we can find a swelling, soft consistency because of the inflammation of bursa. From here, if we slide our thumb pad more proximally towards the humerus, so ultimately we will feel the elastic consistency which is found because of the presence of the tendon of your tricep. For confirmation, again you can instruct the subject to extend the elbow, extend, and here I can feel the elastic, firm elastic consistency between my finger and thumb pad. So this is the location of your tricep tendon, and here we can identify the tendinopathic condition related to your triceps.